Hey guys, in this video we'll be talking about chronic venous insufficiency, also known as CVI. As you can probably guess by the name, the condition involves complications with proper functioning of your veins. Before we get too much into the condition, let's take a step back and review what veins are and how they function. Veins are one of the main blood vessels in your body. While arteries carry blood away from your heart, veins carry blood back towards your heart. In comparison to your arteries, veins are larger and looser. Another quality of veins is that they have low pressure. In fact, did you know that at any given time, about 60% of your blood volume is located in your veins? The lower blood pressure in the veins is a result of the fact that they are larger and farther away from the heart, aka the pump. As you may know, blood flows from the arteries, through the capillaries, and finally to the veins. The capillaries are the smallest blood vessels in your body, and they have the highest resistance. This leads to low blood pressure as well. Since the blood from the capillaries enters the veins, this is also a reason why blood pressure is lower in the veins. Because the pressure is low in your veins, the blood is not able to overcome gravity and move up the veins on its own. Thus, the vein has two adaptations that allow it to overcome this low blood pressure: muscle pumps and valves. As the muscles around your veins contract, they allow your veins to contract, thereby helping to pump the blood. The second adaptation veins have are valves. Valves are flaps of tissue located in the veins, and they help to prevent backflow of blood. With the two adaptations together, muscle contraction pushes blood up, and valves allow for unidirectional flow. Now that we've covered the general function of veins, we can direct our attention back to CVI. More specifically, chronic venous insufficiency is a condition that results when the valves in our leg veins are weakened and unable to function properly. As a result, we no longer have unidirectional blood flow. Thus, blood isn't able to effectively return up to the heart, and instead, it ends up pooling in your legs. Resulting symptoms of CVI include swelling in the ankles and lower legs, pain and aching in the legs, damage to the skin, ulcers, and varicose veins, which we'll talk more about later. In general, there are 6 stages that can be used to classify the progression of chronic venous insufficiency. In stage 1, veins are visible and spider veins may be present. This is where you first start to see signs of chronic venous insufficiency. In stage 2, there are varicose veins, which are bulging and swollen veins that appear to protrude from under your skin. In stage 3, there will be swelling in your legs due to retention of water in that area. Next, in stage 4, you'll begin to see redness and discoloration of the skin. The texture of the skin may also change, and itchiness, flakiness, and eczema may result. In stage 5, you'll begin to see ulcers, which are open wounds in the skin. In stage 5, the ulcers will be healed, whereas in stage 6, they will be open and active. The ulcers formed in stage 6 are commonly known as venous stasis ulcers. There are many causes and risk factors for CVI. Some common ones include pregnancy, smoking, obesity, and inactivity such as long periods of just standing or sitting. In regards to obesity and inactivity, CVI can develop due to the fact that the muscle pumps are not being used enough to help pump blood up your veins. Deep vein thrombosis, or DVT, is also a common risk factor of CVI. DVT is a disease caused by the formation of a blood clot in the deep veins of one's legs. Additionally, varicose veins, which we previously mentioned, are both a sign and symptom of CVI. A history of varicose veins has been identified as a risk factor for CVI. Furthermore, it has been discovered that there is an increased risk of CVI in females and individuals over the age of 50. Treatment for CVI can begin at any of the stages, and there are a multitude of treatments available. The main goals of these treatments is to help prevent the development of ulcers and decrease the pooling of blood in your legs. One treatment is compression stockings. They allow you to apply pressure to your legs in order to encourage blood flow. Medications can also be used for treatment. Skin infections and ulcers, for instance, can be treated with antibiotics. Another medication may also be prescribed to prevent blood clot formation. Certain creams, such as hydrocortisone, can also be used to reduce the risk of fungal infections and to keep your skin moisturized. Both non-surgical and surgical interventions are also available to treat CVI. These interventions involve rerouting blood flow to other healthier and properly functioning veins by way of collapsing, destroying, closing up, or removing veins affected by CVI. Along with these treatments, a physician may also encourage you to take part in regular exercise, elevate your legs at home, and discuss weight loss strategies if necessary. Although treatment has been proven effective, there are many ways individuals can work to prevent CVI from occurring in the first place. For instance, to reduce your risk of CVI, one can avoid smoking, exercise frequently, maintain a balanced and healthy diet, avoid clothing that is too tight or restrictive, manage one's weight, and avoid inactivity, such as sitting or standing for extended periods of time. Well, there you have it. There's your crash course in CVI. You now know what CVI is, what causes the condition, and how it can be treated and prevented. Always remember, say aye to healthy diets and exercise, and say goodbye to CVI.